Do you have a feeling that your hip is kind of just like not in place, or it's like falling apart, or every time that you squat or lunge or something like that, you feel a pinch right in here, and no matter how you move it or whatever, it still hurts? Sometimes it leads to back pain, sometimes your knee starts hurting because of that. You might have a hypermobile hip, and instead of stretching, what we need to do is stabilize a little bit more. Maybe that will help. That's what we're going to be talking about today. Hello good people, Andy Shea from Movement Reborn. Welcome back. Now before we get started, I just want to say thank you for all of the people who shared so much feedback about my hypermobility video in the link over there. I didn't realize how little content there is about hypermobility, especially on the movement aspect. Now movement is absolutely one of the things that can possibly help, but it's also one of the things that will piss things off if not done correctly. So before we get into the movement side, I want to talk about a few other things in regards to hypermobility for sure. Number one, stress management. This is huge because most of the time people with hypermobility have a lot of anxiety, and this is just a personality trait from the people that I've personally seen. The majority of my hypermobile clients are introverted, have high anxiety, and usually have a bunch of other issues going on with the body as well, like gut issues, emotional issues. They had some type of stress and trauma. They feel very fragile, and it takes a lot of energy for them to actually be out with people and stuff like that. So find different ways to be able to calm down your nervous system as much as possible, whether it's just doing some meditation breathing every hour or so, trying out sensory deprivation tanks, getting a light massage, and I mentioned light, breath work, seeking psychological counseling, having friends and family who understand what you're going through or at least can empathize. You need people around you to be able to shed the load of stress so that your body doesn't have to take all of the anxiety. That is number one. Number two, take care of your gut. Nutritional is a very, very key component, but a lot of the times people with EDS or hypermobility have a lot of other health conditions as well. So highly recommend not just seek a typical medical practitioner. Sometimes they'll give you a lot of the things that could help, but sometimes they're just missing a small pieces of the holistic side of things. So I like to look at the body more holistically. Nothing wrong with Western medicine, but I like to personally bridge the gap between traditional and holistic at the same time. So find other sources of medical help. I personally would recommend seek out a really good naturopathic doctor, maybe acupuncture, a Chinese medicine doctor, something non-traditional, because apparently traditional studies are only helping this little. So try out other modalities. If it doesn't work, it doesn't work, but don't give up and don't set into your diagnosis. One of my favorite quotes is by Deepak Chopra, and he says, accept the diagnosis, but not the prognosis. Just because you have something or an issue that's wrong with you doesn't mean that you have to abide by the outcomes that come by it, because most of the times we are so narrow-minded or only know so much about our issues. There's literally 3,000, 5,000, 10,000 other things that we can try. It's just spending time, spending effort, spending our energy to try and figure that out, but also approach it from a clear-minded standpoint and be patient with it. And number three, movement. Let's talk about that today. And especially, we're gonna be talking about the hip. Now, learning how to stabilize the hip is not just about the hip itself. It's the connection from your foot through to the knees, to the hip, to the rest of your body, and how it responds back. Now, a hip issue is never just a hip issue. It's always something below the hip or above the hip that's doing a job that it's not supposed to do, making the hip work even harder. I'm gonna give you a quick example of what's actually happening to the hip itself. Why our hip typically feels so unstable when we're lunging, when we're squatting, when we're moving around and walking and stuff, is because the hip, if we're hypermobile, is out of the socket. For example, the femur, which is the thigh bone over here, is supposed to go into the hip socket. So for example, this is my hip socket, and the femur here is supposed to be connecting into it. So when we hike the hip like this, notice it's actually closer to the joint in this area, and this area there's too much space, so it's not even in how it moves. Typically, we want even joint movement throughout the hip. So notice like the femur should be rotating evenly. We don't want the hip to shift to the side and then bend in that angle because there's too much space over here and not enough space over there. And this is a very typical case that happens when we're lunging and squatting as well. So many other times when we're lunging, the knee pronates, as in it dips inwards, and notice when it dips inwards, the hip tries to overcompensate, so it pushes out like this. And then when we stand up, it does this little wiggle. So it comes up, and then you end up in this position over here. So the whole body becomes this squiggly line instead of having straight force from your foot to the knee to the hip all in one area, and you're driving through. So the biggest tip I typically give for my hypermobile clients when learning where the hip should be in space is, one, starting from a standing position, can you feel this, where you hike the hip inwards, and then from here, you want to squeeze your quad and squeeze the butt cheeks as tightly as you can. So notice, when you squeeze the quad and you squeeze the glutes at the same time, the knee is straight, but it's not locking backwards. So try this out. If you just relax everything and lock the knee back as you usually do, notice this is a locked knee. You literally feel the joint like push into it. Now, if you're able to give access to squeezing your quad and clenching the butt cheek at the same time, when this muscle hardens and it's stiff and this muscle hardens together, these two straighten up the knee and prevents it from actually hyperextending. It looks straight, but it's not locked. That's two different things. So typically what happens with an unstable hip is also an unstable knee. That's why I'm talking about finding that top locked position over here by the hip, pushing inwards so it's hiked so that the femur is directly on top of the foot, and then the quads and glutes are squeezed. The more you can activate the glutes, the more stable the hip is naturally going to be. So the most stable hip is actually about proper glute activation and proper core stability. Learning how to use not just your whole upper abdominals, but learning how to access the lower abdominals, the pelvic floor muscles, and everything like that as well. When all of these can come together, the body will find centration and stability through the midline. And that's what we're looking for. Now we can do that from a kneeling position as well. For example, if you're at the bottom of a lunge position, most of the times the hip is out over here as well. Like if you're going for a lunge, many of the times we're unstable and the hip does this in order to try and create stability. What I want you to do, just drop the back knee down into the ground and then lean into your front leg. And notice what I want you to do is actually pull your knee back, but shift your upper body forward over this front foot. Notice my shoulder is almost like stacked on top of my ankle, and I'm pulling that hip back in space. Now, usually in this position, we might feel a pinch in the inside of the hip over here because the knee is doing this. And what we want to do is have the knee out to point towards the pinky toes and then guiding the hip inwards. So when the knee is out and the hip is out, that might create some tension here too. And going in, if you push too much, then you're hiking into the opposite hip, and that will also create too much tension in here. So the idea is to find that Goldilocks position where you can pull the hip back, and wiggle it around until you feel, oh, my glutes are kind of there. I can feel my weight stacked over that front leg. The hip is stable. The hamstrings, adductors, all of these muscles around here actually feel strong and activated. That is the position that you want to be in. If it feels safe and then you can move through there, that's fantastic. Now, word of caution, this takes a lot of time to figure out where your personal body feels safe moving through space. It's so relative to each person, and it'll be a lot of trial and error. So recommend play around with it a very little bit at a time, because something as simple as this can piss it off because the body doesn't know where it needs to be. And this is where I spend a lot of time coaching my clients of how to feel their body, how to connect to it, how to understand where those joints feel the safest, and then learn to move from that position. Unfortunately, there's no quick fix to teach your body how to learn how to move better. This is just trial and error and seeing how your body naturally works. Now, other things we can stabilize. Now, remember in the middle of the video I mentioned hip stability requires glute activation and core stability. So let's go through some of those movements, okay? And one of my favorite things is the glute activation with a band over here. So this is what we call a hip circle. You can find it on Amazon. It's a material, so it doesn't, you can use rubber bands and stuff like that too, but I really like this material so it doesn't pinch on it as well. Slingshot is the brand that I have over here, but there's plenty of knockoffs that you can find on Amazon as well. The main thing I want to teach you is glute activation over here, and we want to get both of them working to the best of their ability. So you're gonna grab a band, wrap it just above your knees, and what we're gonna do is called a frog pump. So you're gonna put your feet together like this, hands at the side, you're gonna drive the knees out, And from here, you're gonna try and squeeze your butt cheeks up towards the ceiling. And at the same time, you're gonna exhale to engage the core muscles until you feel the ribs flatten into your body, and then slowly down. What I want, knees pointing out. I want you to initiate with your exhale and pay attention to activating the core. So notice if I keep breathing out, the ribs start flattening into the body. And when the ribs flatten, the diaphragm pushes up to give the abs more space to be able to drive air down towards the low belly. That's what we're trying to access over here. These core muscles have to engage with the glutes over here. So at the top, I want you to imagine that you're trying to wrap your butt cheeks around the tailbone, around the sacrum, and the ribs flatten so that the glutes and the ribs meet each other to draw a straight line from your knees towards your shoulder. So you want to feel that there's tension here and there's tension here. Sometimes you'll feel the hamstrings, sometimes you'll feel the lower back. If you feel the lower back, that's usually you're hyperextending and you're going too far up. So when you're hypermobile, this is probably where you're gonna be, where you have a huge arc and you don't know which muscles you need to use. So the more you learn how to activate from the core and from the glutes and shorten that distance, it might feel like you're barely moving if you're hypermobile, because this feels very, very restrictive, and that's probably what you're looking for. As long as you can feel the glutes and you can feel the core activate, you're doing a good job. Try that for like 5-6 reps. If you can find those muscles, that's fantastic. Don't do too much because you can aggravate it, and you want to see, hey, if the movement works, you should feel better immediately after you do it. Like there'll be less tension in the hip or the back. And if it does feel more stable, that's fantastic. Add that to your exercise routine. And try not to do 50 reps at one time. Rather do 5-6 reps and really feel those muscles engage and activate and do them quite a few times throughout the day. Hypermobile people typically have a very sensitive nervous system, so that if they just do one too many, the nervous system caps out and they're gonna be in pain and it's gonna be flared up for a while. So just do a little bit throughout the day to tell your body, hey, it's okay for these muscles to be active, it's okay to be stable, just keep it that way. But don't fatigue it, don't over fatigue it. You just wanna tell those muscles that they're there and they exist. Now, one more movement I'm gonna teach you is a core exercise over here. Now, this is a passive core stability exercise where we're just trying to activate the lower belly transverse abdominis area over here. So what you're gonna do is find your belly button, place your hands just a couple of inches underneath the belly button, and first couple of things I want you to try is do a little cough. Notice if you cough or sneeze, like this muscle over here usually pops up to stabilize. You want to find that tautness down over here. Now try see if you can cough and hold that position over there and keep that tautness. Most of the times finding this connection is really, really tough. Holding that connection is even harder. And this is why we're gonna spend some time trying to feel this movement out. Okay, so if you can't feel it immediately, totally fine. We're gonna try and see if we start moving a limb, does that start changing? Okay, so try cough again, see if you can feel it. If you can feel it for a second, but it dissipates, totally fine. That's a good start. Okay, so try cough and hold, and then from here, pick up a leg and see, does that muscle tighten up even more? If yes, that's good. Pick up the other leg and see if that's even harder. Now, from this position, notice the knees are about 90 degrees. I want you to take a gentle exhale and then see, the more you exhale, can you keep exhaling to flatten the ribs into the body like you're trying to wrap a corset, like your ribs are like a corset, and the more you exhale, the more that's going to wrap around your body. And usually when you start exhaling and the ribs keep flattening, the tailbone gently lifts off the ground. So we're essentially trying to use the core muscles to pick the leg up instead of using the hip to lift the leg the whole time. Usually when we're lifting up the leg, we're using the hip flexors over here. So this is the muscle that's constantly tugging, and that's why this muscle gets so pinchy and tired all the time. We want the core to be able to move the hip. So if we exhale, flatten the ribs into the body, use the shortening distance from your ribs and your hip to pull the legs up. and see if you can feel these muscles doing the work to lift the leg and the tailbone slightly off the ground. Don't do too much over here or else you might aggravate something, just a little bit. And then from here, see if you can hold that space. Exhale again and use the core to lower the hip. It's going to take a lot of practice, but I highly recommend, if this feels good, exhale, use the exhale to pull the tailbone up, and then slowly reset the breath, find the exhale again, use the core to lower the leg. And the less you feel it in the hip, the more you feel it in the core, the better that movement is going to get. Just do a few reps at a time and see how your body feels. Again, most of the times we have issues with the hip because the hip is doing all the job for everything else. So if you tell the core to start working and tell the glutes to start firing a little bit more, then the hip doesn't have to work as much. Now these are only 2 exercises because I don't want the video to be too long. I might actually create an entire course on this. So the fundamentals of movement still stay the same. Trying to get the core active, getting the glutes to fire, getting the lats working for the upper body. Those are the 3 main muscle groups that I really recommend you to learn how to stabilize very, very well. I have plenty of other videos like that on my YouTube channel, and I'm going to be making more as well. Just because you're hypermobile doesn't mean you cannot do any exercise at all. It just depends how you do them and how much you do them. So it's a matter of intensity and a matter of dosage and how it's implemented with your body. The more you can figure these 3 variables out yourself, and the more help you get from other people to guide you into learning about your body is more, that's what's going to help your body feel safer and live more pain-free over time. But again, be very patient, and also take a look at the other 3 factors I talked about in the beginning of the video. I really hope this sheds a little bit more light in hypermobility and how your body works. If this resonates with you, please keep sharing and spreading the word to your friends. I'll be making more videos like this for sure. Any other questions? Shoot me in the comments below. Andy here from Movement Reborn. Peace!